She is so happy because we listened. We're experts at what we do. We do nothing but spinal disc injuries and spine. What I'd like to do is share with you a case history of a real live patient because this might be you. And so let's talk about this. Sheila K came to our office with chronic neck pain into her shoulder, into her arm. We saw there was decay and degeneration in her lower neck. We did our testing and said, look, we think you have a disc injury. She said, yes, I've been told that. I brought my MRI. She brought her MRI. We studied her x-rays. We studied her examination. We said, we think you've got a cervical 5 and 6 disc injury based on the x-rays, based on what we saw on the MRI. There was a herniation there. Jeff, I've wasted a ton of money at other chiropractor offices trying to get my disc fixed, and they're just treating and treating and treating. I said, well, let me ask you, when you first went in, did they recommend an MRI? No, I had to suggest an MRI just a couple weeks ago. I said, so you've been treating for months and months and months with no MRI, and you had to recommend the MRI, and you just got it. I said, that tells me that they were treating with their eyes closed or blind. How do they know what they're treating, right? You've spent thousands of dollars, and you had to recommend the MRI, and just now they're correlating it. I said, well, that's a problem. I said, because they could have been treating the wrong segment, wrong area. And she said, okay, well, I'm really nervous to start anything. I've spent thousands and thousands of dollars. I said, look, in our office, we have so much data and research, I can give you a prognosis. Your doctor should be able to give you a prognosis, meaning they can look into the future based on the care that they've given over thousands of times and say, here's what we expect. So I said, look, we expect a 20 to 40% improvement based on thousands of pieces of research that comes back to from our patients in the first 12 treatments. And I'm in the room with her and she's smiling. I said, Sheila, you're smiling. Yeah, your customer service is phenomenal. My neck feels great. My arm feels great. I said, you're smiling. I said, but there's a but. She said, yes. I said, what's the but? This was like on a Thursday. What's the but? She said, well, I'm nervous to go home now and start using my arm and my neck, doing chores and whatnot because I'm scared of the pain. I said, here's the deal. I want you to do everything you want to do. She said, really? I said, everything, and then report back to me on Monday. So she goes home. She comes back on Monday, and she says, my neck feels great. It hasn't felt this great in such a long time. But, I said, what's the but? She said, my arm is killing me. I said, okay. Well, tell me about that. So, well, I went to reach and do that. I said, no, stop. Your neck feels great, but you went to reach and use and paint and this. I said, Sheila, I think you also potentially have a shoulder rotator cuff injury. She said, really?